Welcome to the Salmon Runs YouTube. Enjoy the video.
You start by confirming the exact dose and the prescribed medication. This prevents underdosing or waste. Once confirmed, wash your hands and set the nebulizer on a clean, level surface near an outlet so tubing reaches comfortably. Measure the medication precisely with a marked syringe or dosing cup, pour into the nebulizer cup, and close the cap securely. Make sure there are no drips. This step sets the foundation for an effective, predictable treatment and reduces contamination risks. Once the cup is filled, connect the tubing to the compressor and to the nebulizer cup. Press until fittings are snug to avoid leaks. Next, place the mouthpiece in your mouth or fit the mask over the nose and mouth. Tilt your head slightly back to align the airways so the mist reaches lower airways. Then turn on the compressor and set the flow to the prescribed liters per minute. Make sure you see a fine mist within 10 to 20 seconds to confirm proper nebulization. You finish the session when the mist stops or the full dose is delivered. Most treatments take 5 to 15 minutes. Once done, turn off the machine, disconnect tubing, and pour out residual liquid. Then rinse the nebulizer cup and mask or mouthpiece with warm water and let everything air dry on a clean towel to prevent residue and bacteria. If you encounter no mist, check the power, remove kinks in the tubing, verify the cup seal, and swap worn parts. This usually...
Thanks for watching. Consider subscribing if we helped you.